Hello, my name is Gina Superczynski and I'm the Infection Prevention and Control Nurse at CGH Medical Center. The CDC is now recommending that the public wear cloth face coverings where other social distancing measures cannot be maintained, such as when you're going to the grocery store or to a pharmacy, especially in areas of significant community-based transmission. Here at CGH, we'd like to provide you some instruction on how to do this without potentially contaminating yourself. The CDC advises the use of simple cloth face coverings to slow the spread of the virus and help people who may have the virus but don't know it yet from spreading it to others. Cloth face coverings should not be placed on children younger than age 2 or anyone who has trouble breathing, is unconscious, or incapacitated or otherwise unable to remove the mask without assistance. The cloth face coverings that are recommended for the public are not surgical masks or N95 respirators. Those are crucial supplies for the healthcare workers. You can go to cdc.gov for recommendations on how to create these cloth coverings, but first what we'd like to do is show you how to put them on and take them off appropriately. Here at CGH, we'd like to give you some instructions on how to properly put on your face mask and take it off, and how to take care of it so that you're not contaminating yourselves. So first of all, I have a mask here. I would perform hand hygiene before putting the mask on for 20 seconds or more. All right. With this particular surgical mask, I'm going to grab it by the ear loops and put it over my ears, and then I'm going to adjust it over. Make sure that the mask covers your nose and is under your chin, and then I will perform hand hygiene again. So when you're in public, be sure that the mask covers your nose. If you're walking around like this, it's potentially contaminating yourself. You can still inhale droplets through your nose, so it's not providing the proper protection. You also should not walk around with your mask under your chin, because you have to consider the outside of the mask contaminated. So when you're doing this, you would potentially be contaminating your face. So in public, in settings where you cannot maintain a safe distance of 6 feet or greater from others, this is when it is an opportune time to wear your face mask. So after I've touched, considering the outside of contaminated, I will perform hand hygiene again. Now, if I'm coming home and I need to take my mask off, I would be careful to touch the outside of the ear loops and put it into a container, such as what I have here. This is one example, and place it into the container without touching the front of the mask, and then I can close it for storage. After I've taken it off, I would perform hand hygiene again. And I would be careful to store this in a safe place, preventing contamination when you're not using it. If those masks become, these disposable masks, if they become soiled or wet, you really need to throw them away and get a new mask, because it's not providing any protection for you in those circumstances. If you're using a mask that you've made at home, a cloth mask, I recommend that you launder it daily. Just run it in your washing machine in the hot water and still run it through your dryer. That will kill the virus. You can use regular detergent. It doesn't require bleach. Regular detergent and high temperatures will kill the virus. I don't recommend washing the cloth mask in your sink, but if you do, use hot water and detergent to do so. When washing your cloth mask, you can wash it with the rest of your laundry in the washing machine. There won't be any issues with that. So the mask is necessary in instances where you can't socially distance from others, like as we said, in the grocery store. So after you've gotten into your car from the grocery store, you don't have anyone else around you, this is a time where you can take your mask off, but if you're doing so, you should be taking it off appropriately and set it in a container. A container, you could use a Tupperware container, you could use a paper bag, but when you're doing that, you're taking that mask off and putting it into if you're putting it in a plastic bag, you really should take care to fold that inside out, so that you consider the outside of your mask contaminated, and so fold it with the contaminated part of the mask inward, and then put it in a container, so that when you choose to put it back on, you're not putting the outside of the mask against your face. You don't have to wear it in your car. If you choose to wear it home, I would just keep it on your face in the car. The mask isn't needed in areas, if you're going out to walk the dog and you're not going to be around other people, you don't need to wear a mask. The mask is protecting you when you're closer to other people. So thank you from CGH. We're doing everything we can to keep you safe. Check our Facebook page and our website for the latest information on COVID. Thank you.